therapist and a psychologist, and Anuradha Chatterjee, who is a mom herself, and with a wonderful topic of Mother's Wellness series is postpartum experience as a mom. I welcome you both to the live platform of Baby Chakra, and I am very very glad that this series that we have started for the month of June is going to be overwhelming for all the people who have these live chats with us. So welcome you both.
Thank
Thank
you
you.
so
Thank
much,
you so
Dr.
much.
Pooja.
Yes. So we all know that postpartum is something which is experienced by most of the new moms as well as the second time moms, but they do not get a chance or a platform to speak for themselves. So let us birth some myths, and let us find out some interesting facts. And Anuradha, who I really like to salute her because she herself came up with the fact that, if we speak about it, we can move out of it. So that with that thought and with that feeling in her mind, she is here to share her journey about postpartum experience which she faced after the birth of her child. So Dr. Anuja, I would like to ask you, like, what a mother goes through, how can we start identifying about it in postpartum?
Right. So, Dr. Pooja, uh, postpartum depression, yes, it is very common. But the thing is that moms need to understand, and they cannot do self-diagnosis. But yes, they must know the symptoms of postpartum depression. But first of all, they must know the symptoms of baby blues. So let us start with the symptoms of baby blues. So what is actually baby blues? Baby blues is the most common condition after delivery.
Okay.
Okay, so baby blues starts right after giving birth.
Mm-hmm.
So the symptoms of baby blues is sadness, mood swings, in fact, frequent mood swings.
Okay.
And there could be the thing like the moms can, like they feel like there's no attachment with the baby.
Mm-hmm.
They feel frequent mood swings. There
Mm-hmm.
is sadness and the persistent sadness. In fact, they also feel hopelessness. They feel very helpless also. Okay.
Okay.
So these are the symptoms of baby blues that starts right after giving birth, or it may start right after 2 to 3 days after giving birth of a baby.
Okay.
Fine. And it lasts about 2 weeks
Mm-hmm.
maximum.
Mm-hmm.
It goes away, it withers away. But the thing is, if it doesn't go away, the baby blues, if it doesn't go away and if it persists even after 2 weeks or 3 weeks after giving birth, then it might lead to postpartum depression.
Right.
Okay, so what is this postpartum depression? How can a mother can identify, or how can a mother understand that she is having postpartum depression or she's being a victim of it? So
Okay.
postpartum depression is basically like like clinical depression. It
Mm-hmm.
is basically clinical depression, but after giving birth to a baby. So what does a mom feel? The mom feels, the newbie mom especially, the mom feels that there is no attachment with the baby, there is no bonding with the baby.
Okay.
Okay, she feels helpless, she feels hopeless, she in fact feels sometimes suicidal as well.
Okay.
Sometimes she also feels like there is no meaning to the life.
Mm-hmm.
She can also feel like there is a frequent mood swings. I mean, the mood swings like a pendulum.
Okay.
Okay, there is persistent sadness, no happiness at all. In
Mm-hmm.
fact, when the baby arrives, the mom feels, oh my God, what happened? How
Mm-hmm.
am I going to feed my baby? How am I going to take care of my baby? In fact, she also might feel like, what is this?
Mm-hmm.
She's my baby. I'm sorry. She's my baby. Here's my baby. Fine. But what? How am I going to feed him? How am I going to feed her? How am I going to take care of my baby? Like, what happened? What exactly happened? What happened to my career? What will happen to my life? Oh my God, I'm stuck.
Yes, I
Seriously,
get
I
this.
mean, the mom feels like this, but Dr. Pooja, let me tell you, it is a very complicated phase of life.
Uh-huh.
I mean, it might it might seem like a joke. It might seem like it's okay, baby, it's okay, new mom, it's okay, you will handle it. But the mom only knows that she is not having mental peace at all.
Okay.
There is no mental peace. There is no. Like she cannot make other people understand that what she's going through inside, what is
Absolutely.
her mental state of mind. In fact, she also, there are a few things I would like to clear about this postpartum depression. Sometimes what happens, like in our book, and in many, I mean, like many moms will Google, and many Google about postpartum depression, and they will also get few myths and facts about PPD as well, that is postpartum depression. But there are a few things about the symptoms of PPD. That is, the mother, like as I said, that there will be no attachment with the baby. It could be the other way around as well. There could be so much attachment with the baby that the mother can feel possessive about the baby. Like,
Okay.
I'm not giving my baby to anybody.
Mm-hmm.
Okay, I'm not going to let my baby uh let my baby go anybody, or to anyone, anyone's lap, or to
Right.
anyone's arms. He or she is mine and not anybody else's. Okay. Now there could be a symptom of, like, I will harm myself or I will harm my baby. That's a postpartum depression symptom, one of the major symptoms. There could be another symptom as well. I'm not going to harm my baby, but I'm going to harm another people or other person if anybody tries to touch my baby. Okay.
Okay.
So it's kind of a paranoid situation or paranoid conditions, or it could be delusion as well.
Okay.
Okay. So the thing is that PPD can also come up with other symptoms like, uh, no, I'm not giving my baby to my mother-in-law. Why? If there could be tussle between the mom and the mother-in-law, and the new mother, doesn't want her baby to go to the mother-in-law, as because, like, she wants her baby to be with her and not to anybody else. So these are all the symptoms of PPD, but that might lead to postpartum psychosis that we will eventually discuss upon. That's
Okay. Thank you, Dr. Anuja. That was a
You're
nice,
most
long,
welcome.
elaborative point where you emphasize on the types of post classical identification of postpartum. Now we have our mom over here, Anuradha. So Anuradha, how did you understand that you were I mean, you did feel that you were having trouble, but how did you have the courage and speak about it openly, and then why did you feel the need of going to a doctor?
The thing is that I was under treatment for BPD. That is, I already mentioned it to Anuja that I was under treatment since 2017. So during my pregnancy, I was under medication. I was having antidepressants, and I even there were some days where I couldn't sleep for 3 days consecutively. So I was like Dr. Anuja said that I had this guilt that the antidepressants they will harm my baby in the womb. So my doctor she reassured me that no, nothing will happen. These are all pregnancy friendly medications. Please take it. So I was doing very fine with those medicines. But right after I gave birth to my baby, I don't know what happened exactly. The moment I saw her face, I thought, is she my baby? What is wrong with me? I have waited for this child for the past 9 months. Now, why am I feeling like this? I am not having any attachment with my child. When she's crying, I am feeling so irritated that I had to feed her round the clock. I had to change her diapers. Why is she crying? Oh my God, please take her away from me. And I was feeling so guilty that why, after waiting for this child for the past 3 years, I'm finally having this baby and a girl child. I always wanted a girl child. So, God, He has given me this precious little thing. Why am I feeling like this? I used to cry profusely day and night. I didn't eat. I couldn't sleep. Means that was a horrific experience. And the suicidal thoughts on top of that, that I want to finish my life. I don't want this child. And I used to tell my husband, if something happens to me, please take care of my child. I used to tell my mother and my closed ones that please look after my baby if something happens to me. So then I called up my psychiatrist who was treating me. And I told her that I'm facing trouble and please help me out. I don't know why am I feeling like this. So she is a very very sweet person. She's like a part of my family now. So she told me that the things which you are going through, these are called postpartum depression, or as Dr. Anuja said, these are baby blues which a mother faces right after giving birth to a child. So don't be scared, you are not alone. There are thousands of moms who are going through same situation like you are in. You need to give yourself time, have these medicines. And of course, as I was breastfeeding my child, I asked her, I was really scared that these will harm my baby. This will harm her neurologically, or she will be abnormal if she grows up. So she told me, no, please, please trust me. These are absolutely breastfeeding friendly medicine. You can have them, and side by side, you can child. And she advised me, what she told me, plenty of time. If you don't want, uh, not feeling to hold your child, give it to your husband, give it to the family members who are there. You are having a joint family, please. I'm sorry, please tell them to look after the child. If you want to rest, please rest. If you want to cook something, go and cook something. If you want to bake, you bake. If you want to read a storybook, do whatever you want to do. Don't feel like this, that because I am the mother, it's my sole responsibility. When a baby comes, like you, family members are also eagerly waiting for their child. She is someone's granddaughter, she is someone's uh, sorry, she's someone's niece, she's someone's sister. So of course, as you are the mother, you will have the majority responsibility will be on you. But please don't feel guilty that you need to take care of your child all the time. Please ask your husband. As my baby, for the first 3 months, she used to stay awake all the night, and she used to sleep in the morning. So
Mhm.
I told my doctor about this. She told me that, yeah, tell your husband to when she will be crying, tell your husband to hold the child, tell her to soothe her. It's not only your responsibility. So like this, I gave myself plenty of time. I told myself, no, this is a phase. It will pass away. This is not permanent. I know this is temporary. So, like this, I want to tell all the moms that please don't be scared. Please, this is a phase which most of the mothers go through. Don't lose hope. Don't take any drastic step. I promise you, this will go away. This will pass. Please do whatever your soul feels like. If you are feeling like to take a walk without your child, go and take a 1 hour walk. Please tell your family members to look after the baby. If your baby is on breastfeed, please pump the milk for her and for him. And please tell your family members to look after the child. Go for a walk, go eat whatever you feel like. Do whatever you feel like. You can do meditation if you feel like, you can do yoga, whatever you feel like. But please take care of yourself, have a good diet, have good sleep. And please, postpartum depression, postpartum blues can't be treated on your own. Please take care of your please consult with a doctor. Please listen to what your psychiatrist says. Trust your doctor, and trust me, with their guidance, with your willpower, and of course the smiling face of your child. The baby will start smiling at you, when the baby will recognize your voice, you will see it will go away like magic. Then you will feel that your creation, this is the most beautiful thing which I have created. I have given birth to a life. I have created.
I think we lost her, but she might come back.
Yes,
Um,
yes.
yeah, so let us continue for one fact of understanding. She was telling about taking care of your own self and, taking care of everything. My question to you, Dr. Anuja, is, in short, if you can let me know that as a mom, she has told that visit a doctor and visit a person who provides you with therapy and medication. But
Yes,
at a given point of time, sometimes the society blames, and the mother feels guilty about that also.
yes.
So a dual mindset comes into picture. So in short, if you can help me to understand that why we should not, how we should deal with this, and then Anuradha can answer the rest of the question.
Sure, definitely. So, Dr. Pooja, it is in our, I won't say it's in our mindset, it is in our societal mindset. You
Okay.
know, it is in our society that the people think it's because of the fact that we have been seeing, like when we were young, we have been seeing our grandmother, our own mother, that they were the only sole people who used to take care of the whole family.
Right. Absolutely.
And we have seen our father, our grandfather, who used to be the sole bread earner of the family in most of the household, I mean, in most of the households,
Correct. Correct.
right? So the fact is that we have seen the gender discrimination, we have seen the gender roles, we have seen that the mother takes care of the child in most of the households, and the father, he too takes care of the child, but he also takes care of the whole family financially,
Correct.
right? So now the fact comes that if the mother chooses, if any of the mother chooses to take care of herself first and then to take care of the child, as because the mother is having some problems, is having some uh, any kind of condition, any kind of physical condition or mental health condition, if the mother chooses to be herself, if the mother chooses to take out some time from her own responsibility to take care of the child, then the whole society, irrespective of anybody, irrespective of any gender and caste or creed or whoever it is, the whole society would blame the mother of not taking good care of the child.
Right.
It is because of the societal mindset.
Okay.
But they have been seeing that the father takes care of the family financially and the mother takes care of the whole family. She cooks, she do this, she does that, she takes care of the child, and she is the only sole responsible person to take care of the child, as Anuradha said.
Absolutely.
Right?
Right.
So here comes the basic conclusion that the mother feels guilty only because of the societal pressure that I have to take the responsibility of my child, and if something happens to me, if something happens to my mental health condition, if I stay aloof from my child even for 15 seconds, then also I'll feel guilty because the society or my sister-in-law or my mother-in-law or my own mother or my father-in-law or my even my spouse might not understand me, or my spouse, even my spouse or my best friend, even my best friend might ask me or tell me, hey buddy, just like giddy up, it's your child, you have to take care of her, you
Right.
have to take care of him. So it's
Right.
all about that typical mindset, that stereotype that has to be brick, that has to be broken, that has to be smashed,
Okay. I
right?
get
So
that.
it's only because of that fact.
Thank you so much, Dr. Anuja.
Most welcome, Pooja.
Anuradha, over here, I would like to say, from the societal mindset point of view, what did you face from the society? Because you openly spoke about it, you openly asked for help. Okay, you had your best doctor to guide you, so whom your association got really close. So, from societal mindset, when they came to know that you were facing this kind of a problem, okay, we try and hide it most of the times. As a mom, I feel कि मेरा प्रॉब्लम है, मैं क्यों अपने सोसाइटी में बताऊं? जब आप बाहर जाते थे या आपको किसी कोई मिलता था, तो क्या आपको वो किसी एम्पैथी के नजरिए से देखते थे या सिंपैथी देने की कोशिश कर रहे थे, और आपकी उस वक्त की फीलिंग कैसी होती थी?
The thing is that मैंने अपने घर में apart from my husband and my mother, I haven't discussed this thing with anyone. I don't know why, but I don't feel like. But of course, when you are going through something, your face tells you everything.
बराबर है.
So when there were visitors, like most of them, they came to see my baby. So they told me that little Bengali কি হয়েছে क्या हुआ, why are you like this, you just now you have given birth to a child, you should be happy. And she's crying, why aren't you attending her, why is your mother attending her, why are you doing like this? So at that point of time I didn't had any answers, as I myself was very guilty that maybe what the person is saying is right, absolutely right, I should look after the child, why is my mother doing so? So um, you know, of course I felt the pressure, like whoever came they told me that I'm not looking okay, I'm looking sad, I'm looking depressed. So few of my friends who came over, and they already know about what I'm going through, I have shared with them. In spite of them they are telling me, come on baka, this is what is this, it's all in your mind, you want you can come out of it, just by sitting in the corner of your bed and crying all the time won't help, go out, have a walk, eat something, why aren't you eating? So these are the questions which I don't blame them, because what I'm feeling वो ये समझ नहीं पाएगा that what I am going through exactly, how will I make them understand?
Correct.
The
Correct.
battle is my own, like what I am going through. My husband, my mother can tell me this sab theek ho jayega, please don't worry, we are with you. But what the thing is which I am facing, let's this gut wrenching experience, this every time I'm feeling that something heavy is stuck here inside my chest. So I don't blame them, I don't blame the society, because it's not their responsibility to feel like what I'm going through, or they will not be able to feel. Depression and anxiety is something, until and unless you walk into my shoes and you are experiencing it yourself, you cannot feel like what I'm going through.
Got it. Got
So these are the things which I personally felt, or which I went through.
it. Right. Thank you so much for sharing that viewpoint of yours. Okay. Anuja, coming to you, can you highlight on a few, two, three small cases, wherein a mother who came to you, you identified her, and probably you could make it, in a way that she is having a classical symptom, or she is having a, severe symptom of clinical depression. So, could you help us in discussing one or two cases of your, moms who came to you?
Sure, definitely, Dr. Pooja. So it was in the year 2020, I guess, when even I also gave birth to my baby. Okay, so there was a time when it was during the COVID situation, the pandemic. The pandemic is still on, and there came a mother who consulted me online. Okay, because I couldn't go to the hospital and she couldn't come to the psychiatric clinic as well. So she consulted me online, and she was very much worried because यहाँ पे एक चीज थी डॉक्टर पूजा. It was like कि she was not having baby blues. In fact, she was also not having PPD. She was also not having postpartum psychosis. It was the other person who had it. You know.
Okay.
Now the fact is that we barely know that even our husband can also go through postpartum depression.
Okay.
Okay. So it was not the mother, it was the father.
Wow.
Yes, it was the father, the new father, who was going through the postpartum depression, who was going through the baby blues at first and then the postpartum depression. यहाँ पे ये चीज थी कि it was the COVID pandemic situation. He was working in an MNC. Then he started working from home as because he couldn't go out to work. Okay, so it was in the month of July that the mother gave birth to the baby, a beautiful baby, and it was going smoothly for the first 2 weeks. After the third week, the father started having, like frequent mood swings. He was not keeping stable himself. He was having um, like he was losing his patience.
Mm-hmm.
He couldn't concentrate in his work,
Mm-hmm.
though he was doing professionally good and he was professionally sound as well.
Mm-hmm.
Okay, he's still professionally sound, and he was good at academics as well, and he was also a very good athlete. But as because of the COVID situation, he couldn't go out to play. He was a very good, I mean, he is a very good soccer player.
Okay.
Okay, so he can't go out, he can't practice, he
Right.
can't meet his friends, and
Right.
he can't just, like mingle, socially mingle with other people physically. It was all on the WhatsApp, it was all on the Facebook, which bored him at the moment
Right.
when it went to the optimum level, and his frequent mood swings went to such a level that he was losing his patience,
Mm-hmm.
and he started behaving very weirdly. He started having fights with his wife, and in a very triple issues, on very triple issues, like ये क्या है, क्या कर रहे हो, ये इसको ले जाओ यार, अरे बेबी को ले जाओ, उठा के ले जाओ, he is crying so much.
Mm-hmm.
So the mother couldn't understand why he is being very, like very irritating all the time, why he is becoming very frustrated all the time.
Correct.
After a few days, after a whole month passed away, then his like the spouse, the mother, the newbie mother, she consulted me. She made me understand that it is not her that is having problems. She is having problems. It was the other way around. It might be like she was very much worried that what happened to her husband. Is it due to mood disorder? Is it something else? Then we had a screening. I had a session with her husband, and then I have a panel of psychologists, clinical psychologists, and then we consult. I mean, like we had a round of interviews, okay, with the husband, and then it was diagnosed that he is suffering from postpartum depression.
Oh, that is
Yes,
a nice case. Thank
yes,
you
yes.
so much, Anuja, because this is something
Most
which we don't highlight.
unaware of it. Yes, we were very much unaware of it. I mean, like, we don't get to understand or get to know that even the father can also go through this postpartum depression. It is, I mean, we always, I mean, like, most of the people, majority of the people know that only the mother goes through. Only the
Yes.
Even
mothers
I
go through
haven't
this
heard of it. I'm
postpartum.
hearing
Yes.
it for the very first time.
Only the mothers go through the postpartum depression or postpartum psychosis, but no, the father may also go through baby blues and can also go through postpartum depression. It could be the symptoms are like the detachment from the baby, irritation,
Right.
frustration, frequent mood swings. Even the baby, if the baby cries, the father would be okay, but then he would be frustrated. Irritated, अरे ले जाओ यार,
Hmm.
इसको उठाओ, रोने मत दो, क्यों रो रहा है, क्यों रो
Right.
रही है, ले जाओ यार, मुझे काम करने दो. Like these kind of symptoms. Okay.
So, with that, we end on a very good note that it is not always the mom to be blamed. The husbands are also equally, I couldn't say to be blamed, but they are a part of the new family because, over here there are three people who are adjusting with each other. First is the mother with the newborn, second is the father and the mother, a new father and the new mom. Okay, their relation has changed overnight. We
Yes.
say the
Yes.
period is 9 months, but when the birth of a child, the roles and responsibilities are so much that the the responsibilities are shouldered, and a new father and what a new mother goes through is only when we come to know, when we openly discuss.
Yes.
And in our hospitalization terms, we always say rooming in. So it's like
Yes.
getting the three close to each other, like the newborn, the new mom, and the new dad, who require their own time, who require their
Absolutely.
own space. And the society or the immediate family, like the nana nani or the dada dadi, who try to, build a wall of protection against these two or three people is very very different. I mean, it is overprotectiveness, and sometimes what could lead to over possessiveness. So if we try to give them their space, I believe that most of our part would be resolved with a lot of good communication, and then
Absolutely.
the flexibility along with the adjustment would be much easier. With
Yes.
this note, I thank you, Dr. Anuja and Anuradha. Anuradha, firstly, because openly speaking up on a live platform is really difficult. Thank you for
Mhm.
opening up over here upon your stories. And Dr. Anuja, you on relating on how Anuradha has, worked up on herself so well. Okay. And to all our viewers, we are coming up with the next topic that is on next Monday. So stay tuned for another live chat on the Mom's Wellness series. It was lovely
Thank you
having
so
you both
much.
and
Thank
have a
you.
beautiful day ahead.
Thank you. Same to you. Same.
Bye
Thank
bye. Thank
thank
you.
you. Bye.
Bye.